For over 50 years, community health workers in the U.S. have played a key and unique role in improving community and individual health and also being part of social and healthcare systems. Since being highlighted in the Patient Protection and Affordable Care Act of 2010, also known as Obamacare, community health workers have received increased attention for their actual and potential contribution to reducing healthcare costs, improving population health, and improving the experience of care. In addition, it is being understood more and more how community health workers can eliminate healthcare disparities and increase health and social justice. In this video, community health workers from Oregon will reflect on how they play the 10 core roles of their profession. The first role includes cultural mediation between individuals, communities, and systems. This includes educating individuals and communities on how to utilize systems like healthcare or social services. And this also includes educating health systems and social services about what are the needs of the communities that they will serve.
I work with community health workers from all over the world, particularly from Asia and Africa. And cultural mediation is an important part of what they do, and I've seen it in a variety of ways. One example was we had a community member that came in to see our community health worker, and she told her that she needed a surgery, but that she wasn't going to have the surgery. The community health worker told her that that was her decision, but that she really needed to understand both the risks of the surgery and why it was important. And so she was able to accompany the community member back to see the specialist who had recommended the surgery and to really have a conversation about why was the surgery important and what were the risks involved.
The second role of community health workers is providing culturally appropriate health promotion information. This means providing information in the appropriate language and also in a way that respects the values and cultures of the communities that they serve.
I provide training and education for women and men from my community who speak Swahili. And because I speak Swahili and I come from the same community, it's much easier for us to be together and talk about the health issues like chronic diseases that we know it's a new thing when we come to this country. How can we be able to eat the right food because everything is different? So because I speak Swahili, it's much easier for my community to have that trust, that we can sit down very casual and speak about the things that not every woman will just go to the doctor and spill out everything that's going on about their health.
The third role is case management, care coordination, and system navigation. This includes many different functions like arranging transportation, doing case management, and documenting work.
Many healthcare facilities now are having community health workers as part of the healthcare team, because we know that navigation and the case management sometimes can be really complicated. So when we have a community health worker as part of the healthcare team, that individual is going to help us to deliver those services, and it's going to help also that patient to navigate the system.
The fourth role is providing coaching and social support. It is the shared lived experiences that community health workers have with the community that they serve that allows them to be successful at this role. Community health workers many times belong to communities that have faced poverty, trauma, and historical oppression.
What we know about the healthcare system is that it's very complex. And we know that from our own personal experiences, family members, loved ones, community members, or our jobs. And one of the things that helps to address that complexity are people to help overcome these barriers. And health is much more than being realized going to a doctor's visits. It's all the social supports and networks that are so important in achieving our health. And so community health workers play a vital role in helping individuals and families connect to the resources and social supports that they need to become healthy. For me, and I think for many other people, we realize that we have two narrowly defined health within a clinical setting and measures. And what community health workers do are to connect people with not only resources, but also social supports and the sense of belonging and a sense of community that is so important to everyone in feeling healthy, being healthy, and really contributing to society.
In their fifth role, community health workers advocate for individual and community needs.
Working in healthcare policy, it's really helpful to be both a community member and a person who has a background in health, because I'm able to speak from a place of both lived experience and training and knowledge that helps folks who are not familiar with the challenges and the barriers that we face in the Native community to see from a real perspective what policy changes they're advocating for really mean for us.
The sixth role that community health workers play is provide individual and community capacity building.
We have learned how important housing and the cost of housing and transportation and access to food and topics like mental health have come up. And then we combined all those conversations into a listening session where they are invited back and they get to speak to one another about the things that are important to them in their community. And what happens is the community across the languages begins to learn about shared concerns, shared areas of interest, and we're able then to invite them to join action teams and begin to think of ways to change policy and to speak back to city and county officials.
In both urban and rural areas, community health workers help people meet their basic needs, which are absolutely essential for health.
As a healthcare provider, I know there's only so much that can be done in a clinical visit. Community health workers are that bridge to meeting people where they're at in the community. Community health workers not only are able to follow up with community members after medical visits, but they also do things like accompanying families to go get food boxes or making sure that they're able to check in on their homebound relatives. Community health workers often accompany families when they have visitation with their children who are in DHS custody. These are really important things to keeping families healthy and strong, and individuals healthy and strong as well.
The eighth role of community health workers is providing individual and community assessments. Many of the serious health problems facing communities today, infant mortality among African Americans, asthma among poor children, violence among youth, are the result of environmental, economic, historical, and social conditions. Because of the deep understanding that community health workers have of their community, their health concerns, and systems, community health workers are specially able to provide valuable assessments to improve health.
I've discovered that there's a high prevalence, of domestic violence amongst my community, especially women. And the way to handle this is by setting an assessment through questions. I set a few questions for the individual, and through these questions, it helps the individual really to come out with all that she has experienced. And many times I find also that there's some evidence from the individual herself, whereby she might have reported the issues or case to the police, or might have gone to the court. So all this I put together, and they sort of form the basis, for intervening about the situation within the community.
The ninth role of community health workers is to provide outreach for communities and individuals who otherwise would not receive the appropriate services.
Ngoài ra, đối với cộng đồng người Việt sống tại đây, để giúp cho cộng đồng người Việt thăng tiến hơn, thì công tác của tôi là tôi tổ chức những buổi sinh hoạt mang tính văn hóa và truyền thống của người Việt Nam, và nơi đó tôi sẽ giúp cho cộng đồng của chúng tôi có thể tiếp tục duy trì nền văn hóa của chúng tôi tại Hoa Kỳ. Ngoài ra, vì những cái buổi sinh hoạt đó, nhờ những buổi sinh hoạt đó, tôi có thể đưa vào những cái thông tin mà sẽ giúp hỗ trợ cho cộng đồng, cho từng người trong cộng đồng hiểu thêm và mở rộng thêm những kiến thức về đời sống tại Mỹ, và đó là công tác của tôi.
The 10th role is providing evaluation and research.
One of the greatest value-added practices that I've seen is inviting community health workers into research and evaluation processes. And why I think that's so valuable is because it actually enhances the research and researchers, the community health workers, and the community.
By supporting community health workers to play a full range of roles, employers can help to assure that community health workers will make the greatest contribution possible to reducing costs, improving population health, improving the experience of care, and eliminating health inequities.
People in communities that have been systematically denied health care and the conditions for health have always organized and sought out training in order to be able to promote health in their own communities. Community health workers and researcher allies have worked together on various occasions to identify the roles that community health workers play and the skills that they need to play those roles.
I personally value community health workers because they are by the people, for the people, and from the people that matter.
Community health workers are able to share a lived experience with the people that they're working with, and they're also able to empower community members through education, through training, through mentorship.
I have never met a group of professionals who inspire me more than community health workers.
I love being a community health worker because I get the chance to walk with people through very challenging life situations.
What I love about community health workers is that they really understand and know their community, and they're able to mobilize and connect with people in a way to truly create change.
I love working with community health workers in my community because it allows me to work with people from different cultures and different ways of thinking about things.
And I think it's so very important that people feel heard and that they feel empowered and that their voice matters, and community health workers help do that.
The roles that community health workers play have been identified and supported through extensive national research, including a National Community Health Advisor study in 1998, and most recently, the Community Health Worker Core Consensus Project.